Hello, everyone. Welcome to the Autism Hour Summit, April 2022 with PlayStreet. My name is Mini Vivedi Gopinathan. I'm the founder of PlayStreet Bangalore, India. I'm an RDI consultant, OPT, and a feeding therapist, an AEC program co-creator called the Play Talk program, and an Access Bars facilitator. As you know, that PlayStreet is an organization that provides educational services to help the child with special needs become independent and live up to their potential. We offer parent empowerment programs and integrated schooling programs and a variety of clinical services. Now you all know that April is Autism Awareness and Acceptance Month. Hence, we wanted to bring to you the experts in the field of autism to guide us all and spread more awareness and knowledge. Today is our 17th talk, and our speaker for today is Dr. Deepa Dharanipragada. Dr. Deepa is a board-certified internal medicine physician from USA. She's a functional medicine physician and also a MAPS-trained doctor. MAPS stands for Medical Academy of Pediatric Special Needs. She did her undergraduation, that is MBBS from India, and also has experience the way medicine is practiced in other developed countries like UK. All these experiences helped her better understand the effort it takes and the sources needed to do good research and how evidence-based medicine works. She learned more about the power of research and about personalized medicine for the first time while assisting a physician scientist in one of his research projects at the University of Chicago. Her case entries were selected for presentation at the national level twice in consecutive years during her residency, and she won the award once. For the last decade, she has been researching ways of repairing and healing, and if possible, reversing early age developmental impact of environmental and non-environmental factors in special needs kids through biomedical and other integrative interventions. He believes once recovered, children can naturally thrive to reach their potential. Welcome, Dr. Deepa. Would you like to say a word to our audience?
Yeah. Hi. Hello to everyone joining us today. Like Minnie shared already, I did my medicine in India, and then I did my residency in internal medicine from the US. Medicine and education, these have been my areas of interest always. And after the residency, I started researching more and studying more about child education, and then did some courses in child development, pedagogy, and education. Then got more interested in functional medicine, and then in special needs population, and did MAPS training, and then the journey continues. And I've been exploring all of this for the past decade, and I hope that whatever we are going to talk about today will help those who wants to know more about biomedical and integrative interventions to help these kids. And from my experience, I learned that timely and appropriate interventions and information to the parents can change the trajectory of the life that these kids can lead. So I hope it'll be helpful.
I'm sure we are going to have a great conversation, which is going to be very helpful to our audience. So let us start our conversation, and I'll start with the question. Do you want to share a few thoughts about ASD?
So ASD is, when we were studying medicine, I never saw a case of ASD in my undergraduation. Even in the books, we had very little information about it, and there was like less than a page of information on it. And I never really understood what it really was or what it encompasses. And the rates at that time, if you look at the statistics too, they were like maybe 1 in 1,000 at that time. And if you look at the rates now, it's like 1 in 54. So it means that instead of seeing a child out of every 1,000 cases, now we are seeing out of every 50 cases, a child being diagnosed with ASD. So even in the community during those days, I never saw a kid with ASD. So I really never understood what ASD means, though I read a little bit about it. And now almost all of us, we know at least somebody who has this diagnosis. And we know that a lot of these kids are not able to lead independent life, and they are not able to reach their true potential because of this condition. Yet, the amount of research we have, or the push for more research, is not on par, I think. And given the rate of increase, I think we all need to understand this condition better, so that the number of new kids that are going to get this diagnosis could decrease, and also those who already are struggling with this diagnosis can have better ways of coping with the struggles that they have and lead a better life and a happy and healthy life. So I think it's a very important topic that we all need to know more about.
That's what we all are looking at. So,
Yeah.
What are biomedical treatments?
So physicians are using biomedical interventions or approaches, as people call. They recognize that there are certain imbalances in the biochemistry and physiology of many of these kids that have this diagnosis. So you are trying to dig deep through your history, and also trying to put together all the things through your detailed evaluations, which include testing and everything also. And then you're trying to understand it better. So most of the times, so in functional medicine approaches are the approaches that are fundamentally used to understand this. Functional medicine mainly nowadays is geared towards adult population, and very little focus is given by most places offering functional medicine training on pediatric population, especially special needs. And MAPS is one that's more geared towards helping the kids that are having special needs. So a lot of parents, they call the treatments that are offered by these MAPS trained doctors as biomedical interventions to say that they are trying those methods.
Okay. And how is it different from conventional medicine?
So conventional medicine, basically we are trying to understand the pathophysiology of a condition. And then you come to the diagnosis. You want to know the diagnosis of a condition. Usually we understand the pathophysiology, come to the diagnosis. And once you know what the condition is, the treatment targets are similar for almost all the patients that you have. And you use those methods to treat. And you are basically looking at it from the disease center. Disease is the center there. But for some conditions, we don't have that understanding of pathophysiology. Like, for example, autism. It's essentially a diagnosis based on observing the kid, right? To put it in simple terms. So when you look at biomedical or functional medicine, here you are more patient-centric. You're looking at the patient and you're trying to look at the whole picture much more in detail. And while we recognize the fact that we are all similar at a certain level, we are all also different at a certain level. So that's what is called like biochemical individuality. So we understand that we are different at a certain level, and those differences can have an impact on our health and well-being. And what might be good for someone might not always be good for another person. And you also recognize the fact that health, wellness, illness, all these are like a continuum, right? There's nothing like you're well, and then all of a sudden you fall sick. The symptom might manifest like that, but something has been going on inside that we are not recognizing. So you're trying to focus more on, if possible, on prevention and maintenance of health when you're using these principles, if possible. And if somebody already is having a condition for which they want to work, then you try to understand the relationship of that person with the environment and those interactions. And also you recognize the fact that it's not just one part of the body that's affected just because the diagnosis is related to that part. So there's web-like interactions that are constantly happening in the body. And when one system is affected, other systems also are affected. So when you're trying to make changes or do any interventions, you put that in the back of your mind when you're addressing things, so that you're always trying to balance things where the benefits are more than if there are any the side effects, right? For anything that we do, there could be a side effect. There's nothing like, nothing is free of side effects, right? Yeah. So you try to understand that, and that's how you look at things.
And as you was talking about, every individual is different. See, autism in general also, we said that if you have met one child with autism, you have met one child with autism. So I think the same is applicable when you look at a child biomedically too, right?
Right, right. That's the main thing that you look at. Because because some parents come and ask, oh, that kid improved on this.
Yes.
And why did my kid not improve on this? Because that kid is different from your kid, right? They're all different.
Yes.
So it helps.
Yes. Though their symptoms might be same.
Right. The symptoms might be same. The diagnosis might be same, but what's causing that might be totally different.
Yeah, that's true. So what is the earliest age can the biomed interventions be started? And also I would like to know, till what age can it help the individual? Because there's a plateau, okay, my child is not 25 or 30, no point going into biomed. So what about, I would say, a good range for our children to get the best
right.
results?
So usually it can help at any age, but usually parents come around 18 months because that's when they start noticing changes, and that's when most of the people, if they are able to get the earliest diagnosis, get it, and they start exploring more, and that's when they come in more. But that said, the earlier you start, the better the outcomes are, because it's like you trying to fix a house, right? The moment there's something wrong, you fix it, then the further damage that can happen from it can be avoided, right? There's a crack, you immediately address it, the crack won't become big, and maybe pests won't come in, and so many other things that can happen won't happen, water leakage won't be there. Similarly with our body, the earlier we start, the better. And sometimes certain things, if you wait for long, can cause damage that might not be easy to reverse. So that said, there's no age cutoff. You can use biomedical interventions at any age, but the longer you wait, the more the complications might be that the child would be facing, the more challenges need to be addressed, and it'll take longer time, and the family needs to also put in a lot more work, and so does the physician. So, but sometimes what happens is some families, if they have siblings that are already diagnosed and they are already using this, they understand this better. So they're always on watch out, because sometimes the siblings might have other issues when they have a sibling with this diagnosis. Like sometimes they might have issues like ADHD, sensory issues. Sometimes they might have medical issues like allergies, GI issues. So whenever they have this kid that they already know is having challenges, these families are very vigilant. And the moment they think that the kid is falling off the track, they will immediately recognize it, and they might come at a very early age, and they get a lot more benefit.
Hmm. So the gist is that earlier we start, the sooner we start, we will get better results, and there is no cutoff age. At
No.
least start rather than not doing anything. At least help the child in some way or other. Yeah.
Right. The main intention is to help the child feel comfortable, right? All of us want to feel healthy and happy.
Okay. So, Dr. Deepa, I'll move to the next question. For how long it needs to be done?
So this is not going to be like a sprint. It's not going to be, like how you go to the regular doctor, you have a fever, take the medicine, you're done. It's going to take time. And the length of the treatment varies on a case-by-case basis. It depends on the complexity of the case. It depends on how well trained the physician is, and it depends on how much effort both of them want to put in, and so many factors come into play. But usually once we start, you tend to see changes in 3 to 6 months, unless it's a very complex case, and then you might want to wait even a little longer before you give up. But once you know something is working, you want to address all the possible issues that you want to address, and that could be worked on. And sometimes it's like peeling the layers of onion, right? What's inside you might not be seeing just by looking at the outer layer. So sometimes as you're doing it, you might find other things that you can address to improve further. And once all those things that you can improve are taken care of, then you want to try to maintain what you got, and you want to maintain health in general, and also you want to optimize if possible by doing other things. So how much somebody can gain, it depends. And also it's a lot of work for the family too. And we also have to look at the feasibility of the families, and also the resources that one has. And but as you go on, usually kids tend to improve, and then the frequency with which you see the physician, they decrease, and then you just maintain it. But in general, like any one of us, these kids are also prone to get anything at any time. And sometimes they might be more prone. But oftentimes you see that the kids don't get the help they need, because everything is pushed under this diagnosis, oh, that's autism, that's how these kids are. And a lot of these kids, they cannot communicate what they're going through. So sometimes they fall through the cracks, unfortunately.
You mentioned that changes can be seen in, say, first 3 to 6 months. So what are the kind of changes are you mentioning? What are the kind of changes can we see?
So you can see, it depends again on the case. Sometimes you see improvement in the awareness of the kid. Okay. Sometimes they might be more happier. They might be eating better. Sometimes a lot of these kids have constipation and bowel problems. Those might get better. If the kid has allergies and stuff like that, those can get better. And in general, engagement and participation with anything that we are doing, they tend to get better. And sometimes also the skin conditions that you see, those get better. Energy in general can improve. So it varies. Also, the learning can get better. It takes time, but things do happen. I'm not saying that it's a magic pill that works for everybody. This is one of the things that you can explore to see if it helps the kid. And good number of kids do benefit.
Since we're talking about the duration, very important point which I would like to bring here is, are we looking at fixing our children, or our intention is different here when we are getting into biomanagement?
Yeah. I don't understand what fixing is, right? What are we trying?
So when we say, oh, my reversed, now my child is no more autistic. The diagnosis is reversed.
I mean, there's no definition of normal. There's no definition of what is normal to begin with. So what we're basically trying to do is trying to make the kid more comfortable so that he or she can do the best she can and reach the best potential that the kid can. Right? We all want that. And we all want to be connected with everybody. And these kids also, they want to be connected. I've seen so many kids who want to be connected, but they just cannot communicate that. And a lot of times they have communication issues because of various health reasons that will be even more difficult and challenging for them to say what they're going through. And any being wants to be connected. That's a very basic fundamental need of a living being. So you want to improve those things. Connection, independence, everybody wants to be appreciated for who they are. They want to contribute. And when they're not able to, it leads to a lot of trauma that they cannot say out, right? Like you and me, say somebody, say one of us got hospitalized and we are not able to talk for any reason. It's a lot of struggle, right? You get frustrated, irritated, because it's hard to say what you're going through. You're in the hospital, you are in an acute condition, you're not able to communicate, you're going through some pain, and it's challenging and it's hard. So that's what we need to think about.
Yeah, it was important to bring this conversation here because the whole idea of Summit is that we have to understand our children better. We have to support them better so that they can live up to their full potential. There is nothing wrong with the children to fix them. We are just trying to help them, and Biomed is perhaps a way so that they don't go through a lot of pain, a lot of other things which they might not be able to communicate because of other difficulties that the children are having.
Right. It has got nothing to do with, changing who they are. You are trying to really understand who they are.
Yes.
To see their personality come through, right? Say a kid is not able to say what he likes or what she likes. And you assume things, right? That, okay, maybe the kid likes this and you're doing that. And the kid is not happy. But one day when he can communicate that this is what I like, this is what I want, the joy that you get just by knowing, oh, okay, this is what my kid wants, that's totally different. You feel as though you won something very precious when you're able to understand the kid, which normal people take for granted, right? Things like, okay, this is my favorite color. Oh, my kid likes this color. All these things are taken for granted. What's such a big deal? But for parents with special needs kids, it means a lot.
Yes.
I'd like to know what my daughter likes. I would like to know what she doesn't like. I would like to know her opinions about things in general. I don't care if she wants to become a rock star or, award-winning Nobel Prize laureate. I don't care really. All I care about is, at the end of the day, if I can connect with her, if she can connect with anybody else, and can she lead a happy life, and can she feel that she can make a difference? And they all want to, and they need help to get to that stage, and that's what we're trying to do.
Exactly the same conversation we had in one of the conversation on mind-body disconnect. That a child was stuck in a motor loop, and child was doing the same thing, and everybody was assuming that that child likes that particular video of Wiggle so much, but actually he didn't like it. He was stuck in a motor loop. It's exactly what you're saying, that we might just assume that they're liking it, but they actually are not liking it. They're just doing it out of some other difficulties, and it's very important for us to help them to come out of it and be able to live the life they like. They can choose themselves, right? And that is where we are also trying to connect consciousness. Be conscious of what they want and how they can take a step towards it. And the parents have such an important role to play in it.
Yeah.
Right? Okay.
Right. Because oftentimes what happens is, as parents, we are trying to play the role of everybody else in the society, because a lot of people in the society, they don't understand our kids. So sometimes they want to communicate to the person on the street, and that person won't understand, and it might take time for these kids to communicate what they want. They don't want to wait. They won't give them the opportunity to say. And some of these kids, they need time to communicate what they want to say, because they have issues with planning, they have issues with speech. And then it's very disheartening for the kid that they were ignored by somebody, right?
Very essential for a parent to play the role of an advocate, along with the role of a parent and a partner and a teacher sometimes.
Right. So sometimes what we tend to do, parents then will realize this is more traumatic to take them outside because they are not understanding my kid, and we try to put them in a safe place where they are comfortable or where they are understood. And then it so happens that we are trying to play the role of the community, we are trying to play the role of the teacher, we are trying to play the role of the parent, we are trying to play the role of the relatives, siblings, cousins. We tend to play a role of so many people, which becomes so hard, and it'll be hard for the kid also to understand how to deal with conflicts and how to deal with people that you're not aware of, about what they like, what they don't like, how to deal with strangers. They're losing a lot on learning, right? A lot of learning doesn't happen in school, like just the academic part. A lot of learning happens because we observe things, right? And emotional IQ, the social IQ that people talk about, those are very important to lead a successful life. And those opportunities are missed, and it's just heartbreaking.
And that's what we are trying to bring it in the summit, that how relationships, movements, consciousness, conscious medicine, conscious nutrition, everything is so important when it comes to an individual who has very different needs.
Right. So and also, I don't think people in the society intentionally are doing it. They just don't know how to facilitate or help these kids also. So the more people in the community also become aware of the challenges and difficulties that we as parents go through or as kids go through, there will be people who would like to help. There might be people who don't want to chip in, but there are also people who would like to contribute. So I think what you're doing would help in the community to better understand.
That is what we are trying, and we hope that it happens one step a day.
Yeah.
So let's move to the next question. Can we begin biomedical treatment without a diagnosis?
Yeah, you can. The way you look at the kid using functional medicine or when you're doing biomedical or integrative interventions, it's different, like we already talked about, compared to how you do it in conventional medicine. So it definitely can be done. But that said, having a diagnosis helps in getting services, and also helps the multidisciplinary team to understand where the kid is, what the level of support is that needs to be provided to the child, so that the child can blossom better. And sometimes you also have these long wait lists in some countries to get the services. So if you already have a diagnosis and you have things that you that the child might benefit from, then things might be easier. So, and also sometimes you might have aid that's given by the government, right? Such sort of stuff, it becomes easier. So it'll be helpful for that.
So how can families choose a good biomedical doctor? Are there any things we need to be aware of when considering functional medicine or biomedical practitioners?
Functional medicine at this point is not a very regulated field. So if you want to work with a physician, you need to make sure that the practitioner is a physician. There are many functional medicine practitioners who are not functional medicine physicians. So if that's what you're looking for, then you have to make sure that they have the medical background, they have the training from the medical school. If that's not what you're looking for, then it's up to you. But to really understand functional medicine, you need to have a strong background of medicine that's taught in medical schools. And some of the testing that's done in functional medicine, it's not like how we do the regular medicine, right? You have a range, this is the number you want, and oh, okay, this is up, this is down. A lot of patients, they tend to do it themselves, right? And they only go to the doctor when they think something is really abnormal. They do the labs on their own. But functional medicine labs, they are different. The way you look at it is different. It's not about one thing. You're trying to put everything together. You're trying to connect the dots to understand the picture. So for all that, having a good understanding of the physiology, the biochemistry, and the other subjects that are taught in medical school, they will help. And also, the more training the physician has, the better his understanding of things will become. And you'll also understand what, one of the main things that you understand with more training is when to ask for help. Like when I was in my first year of my post-graduation, I would think, oh, this is all easy. I can take care of anything now, right? Yes. Then my chief resident, he started giving me all tough rotations, right? More than that's needed. And then you start seeing tougher cases, you realize that there's so much that you don't know. So with more training also, you realize that there's so much that you don't know, and you realize when to ask for help, when to refer, and when to give hope, and when to set things straight, right? And that's important. So those are the things that you need to understand. And also, because the training is given, offered at the functional medicine courses, some of these are offered even to people to work as coaches and stuff like that. They don't have a strong medical background. So whatever they're listening is what they understand, right? But the courses are not prepared like that. They're prepared in a way that you have a certain level of understanding, and it builds on top of that. So it's like me sitting in a, say, an advanced MBA course, right? My takeaways are different from the person who did an MBA, right? So the blind spots and the takeaways, those things will be different. So it's important for us to understand those things when we are choosing a doctor. or a practitioner that you want to work with.
That's very important. So my takeaway from this, what you just said in last 1 minute is, yeah, more we know, we realize how less we know. More
Right.
we study, right? We realize how less we know.
Mm-hmm.
And
Right.
yes, so definitely when you choose, you have to take this into account, right? Yes.
Right.
So,
Right. It's a learning curve for everybody, even for parents, right? Initially, we think that, oh, okay, they're going to do this therapy, my kid is going to be fixed and it's done, right? And then you realize that, oh, this is not just it, right?
not just
and then,
it, yes.
Right. And then you become, you feel low. And then slowly you realize there are ways and things that you can do to support the child better. And then it's a learning curve as long as we live. Same with medicine too. It's a learning curve.
That's true.
Yeah.
But what happens that with time, we start getting less panicky. When we begin a journey, the panics in parents are way too high. But say when the children, like it's after a decade, I think that we start also getting less panicking, and we also start understanding that there are always ups and downs. Whatever we do, there are good at times and there are like lows at times. And I think it's part of any journey. And I assume it's part of the biomedical journey also, the highs and the lows, the ups and the downs, the goods and the bads, right?
Yes. Right. The more complex the thing is, the more complex the condition is. Not just about, I'm not just talking about biomedical interventions, anything. The more the more complex the condition is, the number of variables and the number of confounders you'll be having increase. So it becomes very complex, right? Yes. So it takes effort, and it's a learning process. And what works for some won't work for others. Even in conventional medicine for complex conditions.
That's true.
Yeah.
When we're talking about complex conditions, let's move to our next question. That why should we treat autism and associated comorbidities medically? More the comorbidities makes the condition a little bit more complex, right?
Right. So when we are talking about autism today, right, we are basically talking about not just the diagnosis of autism. We are talking about autism and the associated comorbidities, right? Like you already said, there's no one autism, right?
Right.
Everyone that you're seeing as you're offering your services, they are all different, and you realize that they're all different, right? So basically, you're trying to understand why the child is struggling. And a lot of times they're struggling because their health is not at its best. And when you try to identify the comorbidities that these kids have, and when you try to address those issues, as the health gets better, the child will start feeling better and he will start learning better, right? And he'll start understanding things better. So that's what you're trying to do. We are not talking about those who really consider themselves as neurodiverse and they don't want anything. We are not talking about them, but there are so many other kids who are struggling, and there are so many other families who know that they are having issues that regular person is not able to see, because of which the kid is struggling. So we're talking mainly about those things. And a lot of times those are often missed when you go to a conventional physician, unfortunately, at this stage. And the research is evolving, and always a physician would feel comfortable to do things which is set in research, right? That this is the right thing to do. You're not always comfortable to do things which where the research is evolving. But sometimes generations will pass by before things, become mainstream, especially for a condition which is increasing at such rapid rate. I would not like my kid to wait and suffer till things become mainstream. And in medicine, it takes a long time. It can take like 1.5 to 2 decades in case the research happens the way it should. And you need funding for that, and so many factors come into play. So you are treating the comorbidities, and it's very important because the number of comorbidities these kids have, they also vary from one person to another person. A lot of these kids have problems with their gastrointestinal tract, which a lot of people call as gut, right? Gut problems. You keep commonly hearing parents say, oh, my kid has a gut problem, right? And when you say about gut, the gastrointestinal tract is huge, right? And they can have problems with digestion, they can have problems with assimilation, they can have problems where the microbiome is not optimal, they can have growth of organisms in places where they should not be. And fixing these things can help the child do way better than the child is doing at present sometimes. So it's very important. And then once these, it's like a vicious circle sometimes, right? So once the GI is not working well, they tend to have immunological dysfunction sometimes because a lot of immunity is in the GI tract. And then that will lead to, problems with your detoxification, your detox these detox systems might not be working like they should. And then the body is all connected, right? Nowadays, people are understanding about the gut-brain axis, the gut immunological connections, and the gut-brain endocrine HPA axis. All these things, yes, they all are interrelated and interconnected, right? It's like a web. And one thing can lead to the other if not fixed. So the sooner we recognize, the better the outcomes will be. That's the reason I say, because one thing can lead to another and it becomes much more complex and a vicious circle sometimes.
Can we, sorry, can we list some of the comorbidities for our viewers, for our audience?
Yeah.
Just so that they understand that that is not main autism. Main autism is right different, but these are just the comorbidities which we have to help our child with.
Right. So some of these kids, one of the big issues is constipation, right? A lot of these kids have constipation. They have difficulty evacuating their bowels. And some of these kids, you see the child will be very uncomfortable. And you see that the child bloats after eating sometimes. Some kids, they'll have bloating all the time. And it's not normal for anybody to be bloated. No, normally your tummy should not be bloated. And then and they're not able to communicate, right? Sometimes you see these kids rubbing themselves against walls or on the floor. Have you ever seen these kids? Sometimes they become very agitated. And the kid might be doing well at certain times, but all of a sudden they become agitated. And these are all because of the discomfort that they're not able to communicate. And if you are treating those things, some of those things can be fixed and the kid will start doing better. Another thing is sometimes also this, what people call as SIBO, right?
Oh, yeah.
That's the where the organisms, the microbes are overgrowing in a certain area where they should not be. All these things, if you optimize the digestion, they can be prevented sometimes, right? So a lot of these things happen because your digestive tract is not functioning the way it should. Some of these kids, they have this projectile vomiting-like symptoms, burning in their throat. All these are like reflex symptoms, right? And a lot of times these are not even addressed. And sometimes people tend to, especially in India, because everything is over the counter, right? People misuse them, which can lead to complications again. And whenever we are using medicines, we also should know that everything can come with a side effect, and nothing is forever, right? Any intervention that we do is not forever. So that's the reason you monitor things. But one of the things is PPIs that you commonly see that's being abused. And that can lead to a lot of problems, and nutrition can be affected. Nutrition can be affected when you abuse the drugs. Nutrition can also be affected when the GI is not, the gut is not functioning optimally. And sometimes you will see once this leaky gut people talk about, right? Commonly talk about, you keep hearing leaky gut. So the food we eat, the environment we live in, all these can have impact on how we maintain our health or well-being, right? So sometimes there might be environmental causes that might be leading to these things. Sometimes there might be changes that you could do in your diet and lifestyle that could prevent these things. And once you take care of these things, kid will start feeling a lot better. And like you said, they will learn better. And you'll see happier kid. And also the other thing is some of these kids, they cannot tolerate certain foods, right? Different kids, they cannot tolerate different foods, some of these kids that you see. And sometimes you see that some of these kids have chronic inflammation for various reasons. And inflammation is good when it is there when needed, right? So it's a protective mechanism. But when it continues forever, or it becomes a chronic issue, that will have a lot of problems. And some of these kids tend to have this chronic inflammation, and they'll have high oxidative stress. And sometimes you see these kids banging and, you know, holding their heads. You know, you understand that they're not comfortable. And one of the reasons could be this inflammation that's happening. And this can also happen in any area, but sometimes it can be neuroinflammation, where the brain is inflamed for various reasons because of the gut-brain axis or the gut immunological endocrine axis, various factors that you have to understand by looking at the case at a much deeper level, right? So these are the things that if you look at can be fixed and can be helped. So that's the reason you want to look at the comorbidities and treat them.
Yeah, we are just talking.
I mean, this is such a huge topic. I might be missing a lot of things, but to give just a few examples.
And that's what I was saying. Here, we are just talking about general health of a child. We are not even looking at other things like speech or writing or communication. That comes next. But my general health of a child, where my child should feel happy and pain-free.
Right. And a lot of times you also, see that these kids have this poor tone, they cannot, poor energy, they feel fatigue, right? They cannot do things like other kids. They want to play, but then they cannot do it, right? So they have issues where the energy is not being produced the way it should. So, and some of those things could be supported and could be helped. So the child can participate more with, you know, people around them.
And these are the changes I think we should be willing to make for our child's in general well-being, right?
Mm-hmm.
Rest everything.
Another big issue I forgot, actually, like you're saying, it's such a big topic, and I don't have it written. It's not like a planned thing. Another big issue is sleep, right? Sleep is such an important thing, and sleep is such a big issue for many of our kids, right?
Most.
Yeah, most of the kids.
Yeah.
Some kids have difficulty falling asleep. Some kids have difficulty maintaining the sleep. Some kids, they sleep, but they don't feel refreshed. And there might be so many factors that might be playing into this issue. So addressing that itself can make big change in how a kid functions. So that's one of the big things that we forgot talking about.
So the whole conversation, what we did for this question, it was very insightful, Dr. Deepa. And I think it's leading us to the next question. What are the initial important steps to be aware of when starting biomed intervention?
First thing is we need to know that it's not going to be a quick fix, and there's nothing that we can do where you go in today and in a month or two everything is done. It's going to take time. It's going to be a lot of work, right? And it's going to take energy and time and resources. So we need to first know what we want, what is our goal, because if we know what we want to address first, right, and where we want to seek help, it will help us know who to go to and what to ask for help, right? And once you understand that, you can ask the physician that you're going to about the overall opinion of what they think about it. And it's a collaborative effort and a partnership, basically. It's not like the physician can fix everything for you or your kid, right? There's a lot more for the parent to do than for the physician, actually, because the physician can, it's not easy for the physician also, but the physician will come up with a plan, but unless it's implemented, you're not going to see the results. And that's supposed to be done by you. So in some of the places, it's hard to get what is needed. Some of the places, they don't have the testing. And in such cases, you try to do the best with whatever history or examination or evaluation you have, but always it's better to have more data points so that you can get a clearer picture. So understanding these things before you go to somebody, that this is the work that I need to do, this is what is required, and preparing for that, or finding ways to support yourself through the journey will always help. And another thing is, a lot of times parents or families go to the physician when the child is in crisis. They don't go usually immediately after the diagnosis, when everything that they know didn't work and everything is exhausted. You have exhausted all the possibilities that can help the kid, is when they try to explore sometimes. And when somebody comes in such state, you are trying to basically trying to stabilize the kid first, right? And it's not always easy. And sometimes when you're doing this, you can have ups and downs. A lot of times families don't understand that, and they tend to stop abruptly once they see that it's not going the way they anticipated it to work. So you need to ask the physician about how it's going to be, and you need to be in constant communication with the physician so that they can guide you through the ups and downs, especially when you go in a crisis state. And there's a lot of adjustment and tweakings that need to be done, because like you said, this is a very complex condition and it's a very heterogeneous condition. And that too, you're going when the child is in crisis. There's no way to say this is what is going to help, right? So you have to try out things, and sometimes you need the constant support from the physician. So it's important to have that communication with the physician. And sometimes if you are not comfortable in having that communication, open communication with the physician, it's not going to be very helpful.
Yeah.
And also maintaining a diary actually will be very helpful thing to do. A lot of times when you look back, you know what is the thing that didn't work, what is the thing that worked better, how can you improve things better when you look at your, the journal or what you have written in the book. So that's one of the important things that I think would be of help.
Yeah. And see, while you were talking about that how much effort it is required to maintain it, it was constantly coming to my mind that, yeah, starting anything is easy. But for maintaining, again, you might have to start things as an entire family together. If you're changing diet of your child, so it would be so bad if you are eating very tasty and junk food and your child is made to eat in front of you, or I mean, you are eating in front of him all the junky food, and child is made to eat what you call, right? What is the part of his diet plan? So yeah, the importance of relationships, going together into the journey and maintain it, be conscious about the problems you are going to face and stick there. Look forward to where, like, okay, and look forward what changes will it bring, and also look backward that where were you and where have you come.
Right.
It's
Oftentimes
very important,
parents
yes.
forget that. Sometimes you find parents who are always comparing with somebody else, and they forget to look where they were and how far they have come. Right.
Far they have come, and there's more journey yet to be made. So definitely don't give up if you have started a journey, and understand that things will go bad, things will be good, things will be bad, there will be ups and downs. And with this mindset, if you start a journey together as an entire family, I think this is going to be more contributive to the child. That is what is my personal opinion. I'm like just adding it to
right. That's absolutely right, because a lot of times also there's disagreement in the family, right? Especially the mom might say, I want to try this. Dad might say, I don't want to try it, right? And there's this argument and fight sometimes that happens in the families, right? And that will make it harder for doing it. If there's a way in which somebody can agree upon things and do it, the results will be better.
Yes.
And also the child will be observing all of this, right? Sometimes things can turn ugly.
Yes, and I have seen things turning ugly when parents are not on the same page. I've seen how it has affected the child, and not only just the child with diagnosis, how it has affected the other children in the family too, other members of the family too. Yeah.
Right.
Yes. So you were talking about leaky gut, and whenever we talk about leaky gut, automatically the word which will come to our minds is GFCF diet. Though GFCF is really a very short form, what generally we do is not only GFCF, it's like gluten, casein, soy, preservative, glutamate, so many things, sugar, so many things we try to eliminate. But okay, we will just talk about GFCF. So GFCF diet is a very debated topic in the autism community. Could you share your thoughts on it?
GFCF diet, GFCF means, to begin with, gluten-free, casein-free diet, right? Yes. Gluten is the compound that you find mainly in wheat, but it's also in rye and barley and triticale and other stuff that we are not using commonly in India. Yeah. So gluten-free, casein-free diet, I think, is something that's very safe to do, and also it's effective in many kids. And it's not that difficult, especially to do it in India. We have so many other things that we can use for nutrition, right? We have so many grains in India which are gluten-free. And especially in South India, it's rice to begin with anyways. We don't use that much of gluten other than for snacking. And you have nowadays millets of different types which are gluten-free. And it's very easy to do, especially in India. And I think everybody should give it a try. When you're doing gluten-free, casein-free diet, though, you have to make sure that it's really gluten-free, casein-free diet that you're doing. A lot of times, there's this cross-contamination that happens, especially if someone is buying packaged foods or processed foods. So you have to make sure that that's not happening. It should be really gluten-free, casein-free diet that you're doing. A lot of these kids also have celiac disease, some of these kids. Some people have non-celiac gluten sensitivity. Such kids really benefit from going gluten-free. Also the milk, right? It can cause a lot of problems in our kids, especially if somebody has autoimmunity to folate receptor. You should not be giving them dairy. So when you're saying casein-free, it's milk-free, right? Animal milk-free. So if you want to substitute it, then you can try all these options that you have nowadays, right? Almond milk, coconut milk, oat milk, different things. But
hemp milk.
Yeah, hemp milk.
Best, yeah, I found, yeah.
Right, right. But if you're doing oat milk, you have to make sure that it's really gluten-free. Some of the oats, they might not be completely gluten-free.
It might be cross-contaminated because of
so
produced in rotation with wheat, yeah.
Right. So gluten and these things that we're talking about, also soy, what happens is it can loosen the junctions in the gastrointestinal tract, and it can contribute to gastrointestinal hyperpermeability, which is leaky gut that people talk about, right? And once the things that are not supposed to enter inside, that can lead to a lot of problems. And the folate receptor autoimmunity that I am talking, that I just talked about, this is one of the very important things, because this condition, actually, if you identify early and treat it, the kid will do really well. So it's something that needs to be looked at, because it's something that's really treatable, and you'll have very good outcomes if that's what's contributing to the difficulty that the child is having. So till to rule that out, you need to look at the history, and it's not that difficult to take the milk off, right? There's so many options for nutrition.
The mindset, actually, because I have met parents who say, oh, if I take off milk or if I take off gluten, how is my child to get these necessary proteins? That is one mindset. Other mindset is, I don't believe in GFCRs. That's second mindset. Third mindset is like all these diets are like fads. So again, these are just mindsets, depending upon how aware parents are, or how much, or what is their belief system. So
right, there's so many ways in which you can get nutrition that you're getting by using gluten and also by using milk, right? And also people using all these also nowadays are having the deficiencies, like vitamin D deficiency, that people are more worried about. It has become so common in general population. Almost, most of the people that I see, they are deficient in vitamin D.
And
so
B12
it's not that,
too. And B12 also, I think so, yeah.
Right. And a lot of it, I think, is the lifestyle and the environment that we have created that's contributing, but that's a totally different topic. But it's not that hard to do. And nowadays, more and more research is also coming in, showing that it's showing the benefits. And I think even in 2018, there was a randomized control trial that was done, which showed the benefits of gluten-free, casein-free, soy-free diet and supplementation for these kids. And nowadays, a lot of mainstream medicine people also are recognizing the benefits, and you are seeing many people recommending gluten-free, casein-free diet. And I think it's one of the important interventions that we can do, which is very easy to do and very cost effective, right? It doesn't cost that much to do it.
Yeah,
and it can give good results
yes.
from people.
Yes. So I think GFCF is evidence-based now. It has a lot of evidence to prove now that yes, GFCF works. So it's no more like a fancy diet, right? It's no more. It has an evidence.
And there was there was like some old some study where it showed that they didn't find any measurable gains in short term, but when it was done over a period of time, they noticed benefits. And a lot of these trials and the research, though it didn't, some of the papers didn't show the benefit, the parents could see that it was benefiting the child. So, but now we are having more and more research coming showing that it's beneficial, and it's one of the things to try.
I have come across many parents, those who have told me that, yeah, they did try gluten-free and casein-free, say for 6 months, but they didn't see any results. So my question is, what kind of results were you expecting? So they say, yeah, we were expecting speech to come, or we were expecting hyperactivity to go away, right? So, so I would really like you to perhaps highlight it that, okay, when we go here,
so
what exactly
one of
are we
the things,
expecting?
Right. So one of the things that we are taught is this analogy that we are given, right? So if you're sitting on a chair, right, and there are nails on the chair, which are popping out with the sharp ends, right? You sit on it, what will happen? You'll have pain, right?
Yeah.
You'll feel the pain, right? So, but then do you take aspirin to feel better? You take aspirin, right? And then you sit on the chair. Will you feel better? You don't feel better.
We have to remove the pins.
Right. You have to remove the nails, right? And sometimes there might be so many nails popping out, right? So you remove one nail, will you feel better? Oh, I removed this nail and I'm sitting. Do I feel better? You don't, right? No. You have to remove all the nails if you want to feel better, right? So diet and lifestyle and gluten-free, casein-free is one of the things that you need to do sometimes. For some kids, it might give great benefits just by doing that. And I've seen some kids and families that really started all this journey because they saw this change in their kid because of this, and they wanted to explore more. So you have to look at the whole thing, and you have to see what are all the different pain points, and you have to find them out, and you have to address those issues to feel better. So that doesn't mean you removing one nail is bad, right? So gluten-free, casein-free is one nail that you remove, right? But you have to remove others. But if you didn't remove this nail and you removed all the other things also, you'll still have the pain, right? So it's diet and lifestyle is one of the foundational aspects that we need to look at and we need to do. Sometimes we need to do more after the diet and lifestyle, but if you're not having that foundation of diet and lifestyle, things might not work well the way they should. So it's very important to pay attention to that.
So would other environmental factors also have impact on our children's health?
Yeah, environmental factors, actually, if we don't talk about, it'll be a very incomplete talk is my feeling. So I really want to talk about that. Environment has a role in our health and well-being for all of us, more so for our kids, right? Nowadays, everything is contaminated. Knowingly or unknowingly, all of us are contributing to it. We are so used to using fuels which are not sustainable, right? We use so much of gasoline, we use so much of plastic packaged products. These are all not sustainable methods, and they're not biodegradable, right? And pesticides, all these things, where do they end up? They end up in our elements, they end up in our soil, they end up in our water, they end up in our air, and we are breathing it, eating it, drinking it, and all those will have effects on the health and well-being of all of us. And once somebody is already having other challenges or difficulties to cope with, if this adds on top, it'll become even more difficult. So to say it in simple terms, think of our body as like a trash can, right? So everybody has certain capacity to tolerate, right? And after some time, things will start overflowing. So we need to know that we cannot keep on adding things which will cause harm to our bodies. And we are so used to using all these things and we don't even realize, right? We want to use the phones and computers and laptops. A lot of these things have things which are harmful to the planet, right? So very few of us will recycle or reduce the usage of things when possible. All these things will have an impact on the planet, and whatever we are eating, the quality is decreasing, right? The mineral content of the food is decreasing, the quality is decreasing, the immunity is not optimal. All this is because of all these environmental factors, and they should be looked into, and if possible, we are all used to using all these things. It's not very easy to all of a sudden stop everything, but we need to consciously make an effort to decrease usage of things which are not sustainable and which are not biodegradable. And also we need to realize that our environment has a very important role to play on our well-being. And if other beings are not doing well, eventually we'll be affected because we are all interconnected, right?
Consciousness for sustainable environment, very important. Right?
Right. Right. And also it's very good for us if we walk a little bit more and use a little bit less of vehicles. If we go with somebody else instead of going in our own vehicle, you're also improving our bonding. And
that's true, yeah.
Yeah. So many things can be done to help the environment that we are not doing.
Yes, and it brings movement to our own bodies.
Right. And movement is a very important thing for our kids and for everybody. Movement is something that a lot of people ignore. The benefits of movement and the benefits of exercise are not one or twofold, they're manyfold. So the more chances you give somebody to move, the better their body will function, right? Use it or lose it. Muscle and brain, both. If you use it, it'll get better and better. If you stop using it, you'll lose it.
Muscle and brain both, yes, as you said.
Right.
Right. So we have come to the end of the interview. Anything you would want to share with the parents?
So this journey is not going to be a very easy journey, but it's going to be a journey where you learn a lot, right? At times you might go through situations where you feel like giving up everything, right? And those are the times when you really need to shut yourself off from things that are going to give you any negative impact, right? Sometimes I hear a lot of people talking about how the friends that they have or the neighbors that they have are making it difficult for them, right? If it's becoming difficult, then just eliminate things. You will realize that you have to pick your battles once you have special need kids, right? So just eliminate things that you think are not going to be of use or help, and focus on what you can do. And it's very difficult, especially if you don't have enough support. And some families, there's always this disagreement that keeps going on as how to handle a situation, especially when the special need kid is around. So try to decrease the arguments, if possible, resolve them. If not, you have to find a way which is going to be of, which is going to help you and make you feel better. So eliminate things that are not going to help you. That's one thing that you need to know. Other thing is, find people that are on a similar journey, and you can find a lot of support because they understand you better. Because a lot of times parents feel as though they're not being understood. You want to talk to somebody, but you feel that they don't understand what you're saying, and you feel isolated, right? So find people that are like you and who you can talk with and get whatever support you can. At the same time, realize that your kid, though is having the same diagnosis, is different from their kids. So don't be carried away thinking that whatever they do will help you. So have an open mind. It's always helpful. Have an open mind, do your research, but it's very easy to get lost in the research too nowadays with the explosion of the social media. Everybody has an opinion, everybody gives an opinion, right? And there's so much of misinformation to navigate through. So when you're choosing who you're following or who you're looking up to, keep that in mind. And your schedules usually are revolving around the kids' schedule, right? Usually. When I came to India, I talked with a lot of parents and I went to some schools. And some of these parents, they start early in the morning, and they have this cab driver or an auto driver that comes and picks them up. And it's like they go from one therapy to another therapy. They have 10:30 this, 12 o'clock another one. So in between that half an hour for commute. And then they also eat in the auto or in the car, it seems, some of them. Yeah, and then they have something else. And then they have something else. And then they go home in the evening and they're tired and exhausted, right? And sometimes I see this, I didn't realize the whole impact of this till I heard from them. And then there are so many therapies out there, so many interventions out there, right? You are just lost. So the parents were talking about, oh, did you try this? I'm going there, I'm going to Indira Nagar for this, then I'm going to that place here. One is in Marthahalli, one is in, somewhere else, one is near Lal Bagh. And the traffic in Bangalore is really hard to navigate. Like I used to get tired just going outside. So and a lot of times the therapies or interventions they're doing didn't make sense for me, right? Like you need to understand what will help with what. When you're trying to do an intervention, you should know, okay, is this going to help my kid? How is it going to help my kid? Where is my kid, right? Different interventions, they act at different areas, right? So if a child is having difficulty with, say, severe difficulty with sensory processing, and is having difficulty with movement, very severe dyspraxia, and is having a lot of other health issues too. I doing something that will be working mainly on the cognition will not be of help, right? I need to be doing things which are at the very foundational level. Only then that will help, right?
Right.
So you need to know the therapy that you're doing or the intervention that you're doing, where is it focusing? And is that going to be of benefit to the kid? Because even if we have all the money that we can spend, we don't have all the time, right? A day will only have 24 hours. We all wish that we have 36 hours, right? Because there's so much to research, so much to learn, so many things to do, so many things to try. But there are only certain number of hours. And it's important for all of us, not only the child, to feel relaxed to begin with. Because when you are relaxed is when the body functions well and you're able to think well. You'll understand what is important and what is not. And you will know which thing to try and which thing to not, right? And it was random, like some of the stuff. And the parents want to add every new thing that comes on the market, and they don't know which one to take off. And they were like talking about it. Should I take this off? Should I take that off? Right? It's not just randomly you pick one, take off and try randomly. You need to know when you're trying an intervention, at least for how long you want to try before you move on to something. You don't randomly choose one, then go, don't jump from one thing to the other without giving time for it to see if it's of benefit or not.
So I think you really made very meaningful points. And you also ended with very good note that parent empowerment is really very important, and understanding the rationale of a therapy, that why you are doing it. Just don't do it because it's available. Please understand the rationale and why is it required by your child and how is it going to help. That's very important. And continue to learn. Don't research randomly, and continue to take guidance from the people, those who have made the similar journeys. And that's a very good takeaway from the last question. And that brings us to the end of our discussion. Thanks a lot, Dr. Deepa, for connecting so many dots for our families. In the summit, we have been talking about mind-body disconnect. And with this discussion, we actually went further to understand inside the body of like what is happening inside the body with individuals with autism, and we are able to understand the biological perspective, and you connect it so well it with other perspectives like relationships and consciousness and understanding, and be aware of everything which we are trying to do for our children. So that was a very insightful conversation. So on behalf of our team, I would like to say thank you once again for taking your time out and sharing your knowledge with us. Thank you everyone for joining us today. Take care and goodbye.
Thank you. Take care.